Have you ever wondered how anesthetics work? It's a fascinating subject that's fundamental to medicine as we know it. You see, anesthetics are these incredible substances that can numb pain, induce sleep, or even render us unconscious, all to help us undergo medical procedures without discomfort or distress. They're like the unsung heroes of the operating room, allowing surgeons to perform complex operations while we, the patients, are blissfully unaware. There's a lot more to anesthetics than just knocking someone out cold, though. It's a fine-tuned process with a dozen crucial steps that ensure the patient's safety and comfort. From assessing the patient's health to managing post-operative pain, every step is vital. And that's exactly what we're going to explore in this video: the 12 essential steps to providing anesthetics. So whether you're a healthcare professional or just someone intrigued by the magic of medicine, we invite you to join us on this journey. Let's dive into the first step of the procedure. The first step in anesthesia is patient assessment. This process is crucial as it allows us to understand the patient's overall health status. We need to know if they have any allergies or existing medical conditions that could potentially affect the anesthesia process. It's like piecing together a puzzle to ensure we have a complete picture before we proceed. This step helps us tailor the anesthesia plan to the individual's needs, minimizing risks and optimizing safety. Now that we've assessed the patient, it's time to plan the anesthesia. Planning the anesthesia is our next move. After thoroughly assessing the patient, anesthesiologists take the helm, deciding on the type and amount of anesthetic to deploy. Factors like the patient's health, age, and procedure specifics all come into play. It's a careful balancing act, ensuring sufficient anesthesia for comfort and safety while minimizing potential side effects. This personalized approach allows us to tailor our plan to each unique individual, maximizing effectiveness. With a plan in place, we now move on to preparing the operating room. The operating room needs to be ready before we start. This stage is crucial as it sets the groundwork for the entire procedure. Having all the necessary equipment at hand is vital. This includes, but is not limited to, the anesthesia machine, monitoring devices, resuscitation equipment, and all required medications. Each piece of equipment should be thoroughly checked and calibrated to ensure it's functioning correctly. We don't want to encounter any surprises during the procedure. Next, we need to make sure that all the medications required for the anesthesia are prepared. This includes induction agents, muscle relaxants, and any emergency drugs that might be needed. Also, we cannot stress enough the importance of a clean and sterile environment. It's not just about preventing infections. A clean environment also minimizes distractions and helps everyone involved focus on the task at hand. The operating room is set. Let's move on to the next step, which is the administration of anesthesia. Administering the anesthesia is the next crucial step. This can be done in a few different ways, each with its own benefits and considerations. Intravenous anesthesia, for instance, is often used for its rapid onset and precise control over the level of unconsciousness. It involves injecting the anesthetic drug directly into a vein, usually in the patient's arm or hand. On the other hand, inhalation anesthesia is administered through a mask or breathing tube. This method allows for easy adjustment of the anesthetic concentration and is often used for longer procedures. Then we have regional blocks. These are used to numb a specific area of the body, allowing the patient to remain awake and comfortable during the procedure. Each method requires careful consideration of the patient's overall health, the type of surgery, and the anesthesiologist's expertise. Regardless of the method used, the goal remains the same: to ensure the patient's comfort and safety. Once the anesthesia is administered, it's time to monitor the patient. Monitoring the patient is an ongoing task during the procedure. It's essential to continuously observe the patient's vital signs, such as heart rate, blood pressure, and oxygen saturation. Equally important is keeping a watchful eye on the patient's level of consciousness. These observations help ensure that the anesthesia is working as planned and the patient is in a safe state throughout the operation. With vigilant monitoring, we can promptly respond to any changes. As we keep an eye on the patient, we move on to the next step: maintaining anesthesia. Maintaining the anesthesia is essential for a smooth operation. This phase is all about balance. Too much anesthesia and the patient risks complications. Too little and they could wake up or experience pain. Anesthesiologists monitor vital signs closely, adjusting the anesthesia level as needed. They watch the patient's heart rate, blood pressure, and oxygen levels, all while ensuring the patient remains comfortably unconscious. This delicate balancing act continues throughout the surgery. With the anesthesia maintained, we now prepare for the conclusion of the surgery. As the surgery nears its end, we need to prepare for the conclusion. It's crucial that we start to taper off the level of anesthesia. This is a delicate process, a dance if you will, between keeping the patient comfortable and allowing their body to regain its natural rhythms. We must carefully monitor their vital signs, ensuring they're stable as we ease them out of the anesthetized state. Remember, the goal is a smooth transition to recovery. The surgery is over, but our job isn't done yet. Post-operative assessment is a crucial part of the process. It's here where we monitor the patient's recovery from anesthesia. This requires keen observation and understanding of potential signs of complications. We keep a close eye on vital signs, pain levels, and any possible side effects from the anesthetic. Our patient's safety is paramount, and this assessment allows us to address any issues promptly, ensuring a smooth transition from the operating room. And voila, the process continues as the patient is now in the recovery room. Managing the patient's post-operative pain is our next task. It's an essential part of recovery, and it's about more than just patient comfort. Effective pain management can actually speed up the healing process, reduce the risk of complications, and improve the overall patient experience. There are various approaches to managing post-operative pain. It often includes a combination of medications ranging from opioids to non-steroidal anti-inflammatory drugs, depending on the patient's specific needs and the nature of the surgery. Anesthesia providers may also employ regional anesthesia techniques, such as nerve blocks or epidural injections, to provide targeted pain relief. These methods can significantly reduce the need for systemic pain medications and their associated side effects. Another crucial part of post-operative pain management is patient education. It's important for patients to understand their pain management plan, including when and how to take their medications and what side effects they might experience. With the patient's pain managed, we now move on to the final steps. A post-operative follow-up is essential to ensure the patient's full recovery. It's the pivotal point where we assess the effectiveness of the anesthesia and the overall health of the patient after the operation. This stage allows us to monitor the patient's healing process and to ensure that there are no complications arising from the procedure. Follow-up appointments are crucial in this process. They provide us with the opportunity to address any concerns the patient might have and to make adjustments to their recovery plan if necessary. This could be anything from changes in medication to recommendations for physical therapy. It's all about the patient's well-being and helping them get back to their normal life as soon as possible. Remember, the aim of the follow-up is not just to check on the physical recovery. We're also there to provide emotional support and reassurance. Sometimes the psychological healing is just as important as the physical. The follow-up is complete and we're on to the final step. Documentation is the final step in the process. It might seem like a tedious task after all the critical work has been done, but it holds immense importance. It's like the backbone of medical practice, supporting and giving structure to the entire process. Documentation involves meticulously noting down every detail about the anesthesia process. This includes the patient's initial assessment, the anesthesia plan, any changes made during the procedure, the patient's response, and post-operative observations. It's not just about recording facts. It's about creating a comprehensive, chronological narrative of the patient's journey. This narrative aids in future reference, helping healthcare professionals understand the patient's history, responses, and potential risks better. It also assists in maintaining the patient's medical records, ensuring continuity of care. Remember, documentation is not an afterthought. It's an integral part of the process, a silent observer that holds the potential to influence future medical decisions. And that's how anesthetics work, from initial assessment to post-operative follow-up. So we've walked through the 12 essential steps for providing anesthetics. We kicked off with an introduction to anesthetics, understanding what they are and their significance in healthcare. We then dove into patient assessment, an integral first step in ensuring the patient's safety and the anesthetic's efficacy. Next, we discuss the anesthesia plan, tailoring each procedure to the patient's needs and circumstances. The preparation of the operating room came next, ensuring a safe and sterile environment for the procedure. Administering the anesthesia, a critical moment that requires precision and skill, leads us to patient monitoring and maintaining anesthesia, both of which ensure the patient's well-being throughout the process. Preparing for the conclusion, post-operative assessment, managing post-operative pain, and post-operative follow-up are all crucial stages to ensure a smooth recovery for the patient. And finally, documentation, a step that maintains the continuity of care and is a safeguard for both the patient and the healthcare provider. Understanding these steps can give you a clearer picture of the role of anesthetics in our healthcare system.